We begin the news in West Africa, where the Executive Director and Chief Executive Officer of the National Primary Health Care Agency in Nigeria, Dr. Faisal Shuaib, says 19 states and the Federal Capital Territory have recorded 14,000 suspected cases of diphtheria so far. Shuaib, however, disclosed that over 10,000 of the cases occurred in Kano State, which is the epicenter of the outbreak. He noted that 97% of the cases were recorded in Kano, Yobe, Katsina, Borno, Kaduna, and Bauchi State, with over 600 deaths. The boss disclosed these at the quarterly review meeting of the Northern Traditional Leaders Committee in Abuja. According to him, 73% of the reported diphtheria cases occurred in children aged 1 to 14 years, while 80% of those affected have not received any form of vaccination. And joining me to talk about these is a consultant physician and also senior lecturer, Department of Community Medicine, Babalola University, Ekiti, Dr. Taofeek Adebola Sanni. Good afternoon, doctor. Good to have you join me.
Good afternoon. Thank you for having me.
All right. Now, let me begin by asking you, what exactly is diphtheria?
Thank you so much. Diphtheria is a respiratory disease, majorly, that occurred due to infection by a bacterium called Conobacterium diphtheria. That bacterium is the organism that actually causes diphtheria. And when diphtheria occur, with the infection with the organism produces toxins. And what the toxin does is to destroy the healthy tissue of the respiratory system. With this destruction, a pseudomembrane is formed, like a flap, that now covers the nose, the tonsils, the larynx, which are associated with breathing. So that individual will then present with difficulty in breathing, difficulty in swallowing, and that individual may actually die. So that's diphtheria, looking at it from a broad perspective.
Right. Now, Dr. Sanni, what are the causes of diphtheria? What are the causes?
All right. I've said that earlier. Diphtheria is caused by that bacterium, Conobacterium diphtheria. However, when an individual is infected, that disease will actually spread.
Okay.
Through the following.
Okay, Dr. Sanni, let me chip in there. When I say what are the causes, I meant, are there lifestyle changes that could lead to one contracting or having diphtheria? That was what I meant by what are the causes.
Yes. That's what I also want to explain.
Okay.
Yes. When an individual has diphtheria, that individual coughs or sneezes into the air, there is formation of air droplet, and the inhalation of this air droplet can actually cause diphtheria in other people who inhale it. That's why people talk about face masks, so that you don't inhale the droplet from an infected person. Also, having contact with an infected person's secretion, maybe the mucous membrane from sneezing, the sputum from coughing, can also infect that individual, another individual. We also have a kind of diphtheria that affects the skin, a cutaneous diphtheria. And when this occurs, when an individual has contact with the sore or with the ulcer on the skin of a diphtheria-infected patient, that individual too can also contact diphtheria. Those are the mechanisms by which diphtheria can actually be contacted. And it is said that it is common in unimmunized individuals.
Now, let's take a look at the figures given by the agency, the National Healthcare Agency. Now, the epicenter for these diseases, Kano State. We have other named states like Yobe State, Kaduna, Katsina, among others. Now, what do you think is responsible for the prevalence of these diseases in these areas?
The diphtheria we're having presently, and looking at the areas that are affected, we'll say it is out of breakdown in our immunization system. Usually, we should not be having diphtheria again in Nigeria, looking at the fact that there are vaccinations to prevent these diseases. And these vaccines are available and they are free. They are part of our national immunization schedule. And every child less than 1 year old should have taken a complete doses of diphtheria vaccination. However, in the northern part of the country, vaccination has been difficult a little. Number one, it may be due to religious beliefs. Some religious individuals believe that vaccine should not be taken. It's a way of eradicating population and all that. So some people willingly will not take vaccine. That will call vaccine hesitancy. Also, on the other hand, because of cultural belief, some individuals believe that they must take permission from their husband before vaccination is done. And when these husbands are nomadic farmers who goes into the bush to farm for months or go with their cattle around to also farm for months, the mothers who are at home, because they cannot reach the husband who is the father of the house, they may not be willing to take vaccine because they need the authority of the man to take vaccine. So cultural beliefs are also there. We also know that in the northern part of the country, we are having insecurity. And because of insecurity, many far away places that we used to go then to deliver immunization vaccination to individuals cannot be reached again because of the insecurity in the northern part of the country. So the combination of religious belief, the cultural belief, and also the insecurity in that part of the country can be a good explanation for the reason why we have a breakdown in vaccination in that part and the reason why we're having this diphtheria. Also, according to what you said, 80% of those who are infected are actually unvaccinated.
Right.
And our vaccine coverage in Nigeria now is still very low.
Okay. Now, let's talk about protection, prevention here. Let's talk solution now. You talked about the need for vaccination. Yes. Beyond vaccination, how would one or how can one, guard against contracting diphtheria?
Number one is for who are to travel, let us avoid traveling into areas where we're having epidemic presently. So let's avoid traveling into those areas or taking our children who are to public awareness about this disease. Let people know that diphtheria is around us and we must protect ourselves. Number three, we should also use face masks. With the use of with diphtheria, it will be sure that we may not be able to contact the aerosol that is the causative organism. But the most important thing is vaccination. Let us ensure all our children are vaccinated. And vaccination is taken. We have pentavalent vaccine that contains diphtheria, tetanus, HPV, and Haemophilus influenza. And it is free, available at all our health centers. Once our children less than 1 year old are vaccinated, we can be sure that we are secure. Also, for those who have been vaccinated in the past, at the age of 11, 12, a revaccination can be done. That's booster dose. And it's also documented that giving the booster dose every 10 years will also prevent us from contracting this disease. Also, the diphtheria that affect the skin, that's cutaneous diphtheria. It has been said that good hygiene, personal hygiene, cleanliness and environmental hygiene can also prevent contracting the cutaneous diphtheria.
All right, this is where we end the conversation this afternoon. Thank you for your insight, for your contribution on the program. Dr. Adebayo Taofeek Sanni, Senior Lecturer, Department of Community Medicine at Babalola University. Thank you for your insight.
Thank you for having me.